Bismillah ar-Rahman ar-Rahim. We shall now discuss the patient's rights and responsibilities. Next. Now, the most important right of the patient is the right of autonomy. The patient has got an autonomous right to consent to any procedure done to them, and this consent must be an informed consent. This means that the patient must be told what is going to be done, why is it done, what are the consequences, what are the consequences of not doing that procedure, and what are the alternative procedures. And then we need to make sure that the patient has understood the explanation and disclosure. We need to give the patient time to ask questions, and we answer the questions. After all of this disclosure, then the patient can give consent, and we go ahead. Refuse of consent is the same. We need to explain to the patient what are the consequences of refusing consent, and if they insist, it's their right. We cannot force a mature and competent patient to undergo a procedure if they do not want to go to undertake that procedure. Proxy consent is when the patient is unable to make decisions. The patient may be unconscious, or the patient may be mentally incompetent, in which case the family can make decisions for the patient with regards to treatment or refusal of treatment. For children, it's the parents who make the consent for children. Generally, when children are very young, below the age of 7, which is the age of discrimination, sinu tamyiz, the parents make all decisions. After the age of discrimination, children have got some intellect. They are able to understand. We also involve them in the process of consent, but we don't tell them that they are giving consent. They give assent, because if the children make a decision and the parents make another decision, we take the decision of the parents. But involving the children in the consent process, you gain their confidence, and maybe they will be more compliant with treatments that may be necessary later on. And mental patients don't have the mental ability to make decisions. Therefore, decisions are made for them regarding their treatment, and in several countries there are laws that govern the processes for consent and treatment of mental patients. The unconscious, as I mentioned before, those who are unconscious, their family make decision for them. Sometimes they may designate in advance who will be the decision maker. This is called an advance will, advance directive, or a living will. Has got various names. It is always better if a patient, while still healthy and mentally competent, tells us whom he wants to make decisions for him, because when the time comes, we know exactly what to do next. Now we will see some case scenarios to apply the principles that we have discussed above about autonomy. Case scenario number 2. Case scenario number 3. Case scenario number 4. Case scenario number 5. Now, privacy and confidentiality are rights of the patient. We cannot enter into the patient's privacy without their consent. Taking history, you need to get consent. Examination, you need to get consent. But once we gain information about the patient's privacy, we must keep this information confidential, and breaching this confidentiality is a serious ethical violation. Next. Now, we'll look at some case scenarios dealing with the issues of privacy and confidentiality. Case scenario number 2. case. Now, disclosure and truthfulness. Physicians are obliged to tell the truth. Now, what is disclosed? We are supposed to disclose everything to the patient, but depends on what the patient wants to hear. We don't tell them more than what they want to know. But if they want to know everything, we must tell them everything. Partial disclosure, white or technical lies are frowned upon, but if they are used, they should be for a temporary period. Eventually, we need to come straight and tell the patient all the necessary information. We cannot disclose to others about the patient without the patient's permission. Usually, if the family want to know information about the patient, we ask the patient if he agrees that we tell the family. In most cases, patients do agree. Then we can discuss issues of the illness with the family, and we need to know how to give bad news. Now let us look at case scenarios on disclosure. Okay, next case, scenario number 2. Thank you very much for listening.